Really what the MVT is all about is making sure that the interventions we use are not only evidence-based in literature, but evidence-based in terms of our outcomes. So we invited QualPro to the table to really take a look at how we could go back and maximize our approach to the patients and members.
Our goal is to really reduce unnecessary or avoidable acute utilization. So that's obviously one of our key measures. We're also looking at the cost that's involved, both on the outpatient, inpatient, physician, and pharmacy basis. People have been extremely engaged, extremely excited about this process, and I think that speaks to the power of MVT.
We already have seen between a 10 and 15% reduction in our admissions within our population.
My goal was to decrease surgeon dissatisfaction or increase satisfaction, to decrease our OR turnover time. Our goal was to reduce each of these things by 15%. What happened was we reduced the turnover time by 42.7%, non-productive time by 23.9%, and physician dissatisfaction, we reduced that by 43.9%. 5 factors that help were able to do that for us.
Our goal, once again, when we looked at the results, was to maintain our gains with the Press Ganey. And, well, we didn't only maintain our gains. Our patient satisfaction skyrocketed from the 76th percentile to the 99th percentile overall. Our door-to-doctor time decreased 24%. And that's a big change when you're talking about an emergency room. We're the top ER in Tennessee in patient satisfaction. We chose block scheduling because we wanted to improve physician satisfaction with the scheduling process. The overall impact at the end of refining was case minutes. We had a potential 20% change, case volume 21%, and what's most important, at least to our CFO, is that 41% revenue percent.
Because of our reluctance to go after anything that wasn't easy, Truman was experiencing another $7 million a year in write-offs, cash that should have been coming our way. So we did bring another $9.6 million to the table this past year. Many of those are factors that QualPro identified and implemented for us. And I will tell you that those weekend discharges, right now we're averaging, about another $375,000 on each Medicaid remit that we get. And we get those twice a month. That's huge for us. That's $750,000 a month.
Had we gone with what we predicted would help, we wouldn't have seen as much improvement. Okay, so here are our results. So was it a success? Yes. We were able to get down to our 15% reduction.
Our goal was also very aggressive, which was to reduce the number of hypoglycemic events by 50% using MVT. I would have been happy for 20%. So the goal was very aggressive. We had a lot of fluctuation, but that final dot there on September 2012 was a 51.6% reduction from our baseline.
Results matched what QualPro had predicted and seen in all of their other tests. Of our 34 great ideas, only 1 in 4 helped us, 1 in 4 hurt us, and half of them made no difference. And so this is our first call performance chart, and you can see that with the first test alone, we actually achieved our 10% improvement goal in that first 2 months of testing. And then even more improvement as we move to refine, and we see that 24% improvement. So certainly we were ecstatic with those results. We had never achieved breakthrough performance. We'd gotten incremental here, we'd gotten a little lift here, and this truly is breakthrough performance. MVT gives you the opportunity to test all of those great ideas before implementation. And we've used this methodology in both a commercial healthcare population and as well as a retiree Medicare disabled population. So we certainly know that it works in healthcare across the board for us. So if you need that breakthrough performance, we certainly need MVT.